They stopped the study short by a year. Why? Because they found a 5-fold increase in heart attacks. So the Safety Commission stopped the study, and therefore it wasn't published.
When you're approaching a problem, the best way to go about it is to go from many different angles all at once.
I would venture to say that the majority of our inflammatory insult onto the heart is actually just blood sugar fluctuations.
The myth is that fat is bad for your heart. What matters is what kind of fat. They put 20,000 women on a low-fat diet for 8 years. There was no decrease in risk for cancer, no decrease in risk for heart attacks, nothing with these low-fat diets. The women who are on a low-fat diet didn't even lose weight.
I said, well, let's check your cholesterol, let's check your sugar levels. It's about a decade ago. Through the roof. That gave him a bit of a scare. He started backing off, would probably tell me how he resisted that Coca-Cola that day, and so he was really just dabbling in reducing sugar, but not really doing the corrective stance that he was supposed to.
People were driven away from fatty foods and towards high carb, high sugar, starchy foods.
He was just reducing, and reducing is not enough at that point. You gotta do corrective measures. And then I heard, had a fatal heart attack. It was so preventable. It was so preventable just by decreasing inflammation and just letting those arteries clear themselves.
Since we started with this obsession with low-fat everything, obesity has doubled.
We could put him in boot camp, which is our lifestyle therapy, and watch that number normalize within a month.
That's the lie that we've been fed for a long time. That as you get older, you get sicker. That's just how it goes.
We control the lever as far as the input for genetic expression. That's toxicity, that's oxidative stress, that's like rust on metal, that's your liver not being able to cope with everyday life, with all the junk you're pouring into yourself and all the stress you're exposing to yourself to. So methylation fixes that. It can actually reverse it. It's almost like giving yourself a new heart. Same genes, different environment.
Lifestyle really changes everything. They lowered triglycerides by 35%. 35%. The Mediterranean diet only did it by 14%.
Reduces your risk by almost a third. A handful a day, that's it.
Statins really, really, really deplete this.
In the end, with statin use, the best they could come up with was decreased risk by 1%.
But look at all the potential side effects. These all lead to other things down the road.
The group taking the statins, they followed them for 3 years, had a mortality increase almost 3-fold compared to the people doing nothing. It is amazing how much damage that statins is causing in this country by decreasing economic productivity due to fatigue, depression, and increase in disease.
Only 9% on the CoQ10 died versus 17% not doing CoQ10.
And there you see the gleaming edifices which are a testament of our lifestyle. Statin thus has indirectly increased a heart attack risk tremendously. The incurable was cured just by resupplying what the body needed. It is amazing what you can do to change your heart health.
Lifestyle makes much more of a difference than just taking a drug.
And they did some studies on testosterone supplementation in males. I wish they included females too, because females are also doing this, but this was on males. And they did a placebo versus the testosterone supplementation. They stopped the study short by a year. Why? Because they found a 5-fold increase in heart attacks. We're not talking just a 20% increase like hormone replacement therapy for a woman. So no, 500% increase in heart attacks. So the Safety Commission stopped the study, and therefore it wasn't published. And what's shocking about this, testosterone supplementation is continuing on, and we have just started up a new trial to figure out, okay, what's actually going on. And I don't know how long it's going to be before those results are going to be published. And as we discuss statins down the line in a bit, I'll get into this a little bit. But isn't that just absolutely shocking? And I'm just to this day saying, well, why hasn't it hit the headlines? And it's because really our whole pharmaceutical industry is just, it's an industry. It's a multi-billion-dollar industry on statins alone, let alone some of the other drugs. And if you look at the company model of how are they wanting to increase their profit margin, it's really by getting more patients on meds. But honestly, we're almost maxed out here, if not beyond maxed out. The average 65-year-old is now taking 4 prescription meds. And that in and of itself is a crime. And I have plenty of patients that come in with at least a dozen meds, at least. And how can you be healthy? How can you survive? So, interesting phenomena. I'm rambling here a bit, but an interesting phenomena is that my home country, this medicine has always been the main fabric of medicine there. This is the first go-to, and a good friend of mine who's an emergency room physician spent a year in the Netherlands in Amsterdam. I got talking with her just a few months ago. Says, you know, with your experience of the Netherlands, because she is American, I was just curious from an American physician perspective, how does that rank for the Dutch? He says, well, how was that experience, just working in a Dutch emergency room? She says, you know, you just have to think for a bit. She says, they use common sense. I thought, that's actually kind of profound, because no, they don't just throw a CAT scan at you, which, by the way, was just published last week in an opinion piece, has the equivalent of about 1,000 x-rays, just a CAT scan, and we're just banning that about. And we now think that 7% of our cancers are due to CAT scans. Just common sense gets used. It's not just covering your butt all the time, it's doing what's right for the patient. It's interesting to note that the Netherlands, and for those of you not familiar with me, that's my home country, just got ranked #1 in quality of food eaten in the world, as well as #1 as far as overall health of the citizen. For the first time in about a decade, we beat Switzerland. So that's, all right. So Dr. Kate's gonna run with cardiovascular health to start us out, and then Dr. Stacy is going to follow through, and you're gonna be stuck with me at the end. Okay, so take it away.
Great. Okay. Functional medicine, our wheel, right? This is our best friend in functional medicine, and we're going to talk about a lot of different ways that each topic within the wheel affect the cardiovascular system, whether positively or negatively. So to pick one out, let's see, all of our environmental issues, so the things that we're eating, right, the diet, things that we're putting in. We're going to talk a lot about fat and sugar and cholesterol and how that affects cardiovascular health and disease. There are a lot of myths out there about what kind of foods or what things that we put in our bodies that help or hurt our heart. We'll be talking about some pharmaceuticals that may help or hurt our heart and cardiovascular system. And that's just the environmental part of this. So you'll see as we go through all of our topics, we try to hit a lot of these things, a lot of these different subgroupings. And as well, when I talk to my patients too, I try to stress that when you're approaching a problem, the best way to go about it is to go from many different angles all at once, instead of just addressing one thing and saying, oh, that didn't work, let's try something else. It's a very holistic approach, and it comes back to this, this idea of the web or the wheel of health. So to start out, I'm going to go through a couple basics with you about the heart. One of my passions going through school is always anatomy and physiology, and so I like to be able to share that with you when I can. When we talk about the heart, you'll notice we don't really talk separately about the heart. We talk about the cardiovascular system. A lot of focus gets put on the heart because it's easy to talk about and it's kind of easy to understand. The problem is that it connects very intimately with the lungs and also all of our circulation. So our arteries, our veins, our venules, our arterioles, our capillaries, that's all part of this whole system, and it runs throughout our entire body. All of our circulation is part of that, and actually tends to have more issues than the heart itself. Cardiovascular disease specific to the blood vessels is much more common than cardiovascular disease of the heart muscle itself, like an infection of the heart. So when we're talking about heart disease, most of the time we're actually talking about blood vessel disease, which is interesting. We don't always think about that. The cardiovascular system, we talk about the heart because it's the star, it's our main pump. It beats around 2.5 billion times in our lifetime. The heart starts beating at week 4 after conception and doesn't stop until we're dead. That's incredible. That's an incredible fact. And an incredible system that continues working. Part of the reason it continues to work is that it's got its own electricity. The heart has its own nervous system separate from the body. You can actually remove the heart entirely from the body, and as long as you supply it with an oxygen-rich environment, it will continue to beat all on its own, which is kind of crazy. I remember doing that when I was a student. We would dissect frogs, and we'd watch the heart continue to beat. We would leave it in a solution so that it would continue to get oxygen, and that demonstrated to us that the heart actually is very independent of the brain. That's why a lot of times you'll have arrhythmias and different problems that the heart itself, the electrical system within it, can become damaged and cause disease as well. One of the fascinating things about the heart, very unique to the heart. Another thing we don't often think about when we talk cardiovascular is blood. Blood we think of as like a filler, right? It's kind of like the in-between space, but it's actually a tissue, just like muscle is a tissue or fat is a tissue type. Okay, cartilage. Blood is its own tissue type. It's liquid, but it still has its own nuances and its own issues that can go along with that. So while we don't necessarily always talk about the blood on its own, unless we're talking about a disease specific to the blood, say anemia, right, is a common example of a blood disease. It is, again, a key component to the cardiovascular system because that's what's transporting everything. Your heart and your lungs can do whatever they want. They can function perfectly, but if your blood's not working right, then it's not going to do you any good. So some really interesting things about the cardiovascular system. Historically, when we look at the heart, a lot of times the heart is associated with passion or love or the soul, right? We write hearts on our Valentine's Day cards. And they don't really look like hearts so much anatomically, but we associate it with that. And that's because of history. The ancient Egyptians actually believed that the heart was free-flowing within the body. It could move around as it saw fit. And it would press on different areas, causing different problems or causing different emotions because the heart would wander throughout the body. Aristotle actually is the first one to coin the term heartfelt. The reason that he thought of this term was because he believed that the heart gathered sensation from around the body via the blood vessels. So he was really thinking of the brain and the nervous system. He almost got it right, but it was actually the heart that he attributed all of that to. So that's where we get the word heartfelt, which is kind of interesting. TCM, or traditional Chinese medicine, doesn't even recognize the brain at all as being part of our bodies. It has ignored that entirely, which I thought was fascinating. It attributes just about all of the brain's capacities, thought, the seat of passion, okay, to the heart. The heart is the one that stores the life force in traditional Chinese medicine. Again, kind of reaffirming that idea that the heart is very central to the human body, which it is anatomically, just not in the thought or feeling way that we often think. Medically, as we advanced, we learned more about the heart, that it's actually very much a pump. It's machinery within the body, that it doesn't have those thoughts or emotions necessarily associated or stemming from that. Advancements in understanding how the heart works, though, didn't happen until the early 1900s. So very early on, 1903, I believe it was, we did our first electrocardiogram, or EKG, ECG, sometimes we call it, measuring the electrical activity of the heart. So that was way back in 1903. Closely following that, some brave person decided to do their own heart catheterization. I think that was in 1929, was that the first heart cath. He decided to pick one of his large vessels and string a catheter right up his own, because he obviously couldn't get a volunteer, I'm assuming. And so bravely ended up with the catheter inside the heart and could do some experiments that way, which is fascinating, back in the 1920s. early 1930s. Next big medical advancement was not until 1969 with the first successful heart transplant. So not that long ago really. The patient only lived 18 days after the heart transplant, but the fact that it continued to beat and was functional is considered a success. Now heart transplants are actually pretty common. Fascinating enough. So when we talk about heart disease, there's a lot of different things that spring to mind for me as far as what subcategories do we talk about when we talk about heart disease. So I'd like to poll the crowd and see what kind of heart diseases do you think of as being more common? Some common heart diseases, shout one out.
Artery disease.
Yeah, artery disease, specifically maybe atherosclerosis, right? Or plaquing of the arteries. Yeah. A heart attack, very good. Cardiac arrest, right? Where the heart muscle, actually part of it dies and is unable to function, making the heart's pump inefficient. Very common.
Congenital heart disease?
Congenital heart disease, correct. Congenital meaning was there when you were born, right? So when you talk about or hear about a baby that was born with a hole in their heart, right? That's a common phrasing of that kind of disease. That's a congenital issue that they're born with. A lot of those things are corrected surgically very early on in life.
Congestive heart?
Congestive heart failure, yes, very good. So when the heart becomes very inefficient, the muscles stiffen up or they become bigger than they're supposed to and they can't pump very effectively. One of the risk factors for that would be high blood pressure or hypertension, another very common cardiovascular related disease. Any others you can think of? How about infection? Rheumatic heart disease, maybe one that happened more commonly before but can damage the heart valves. A lot of times they'll worry about heart infections secondary to dental procedures, which is why a lot of times you'll have to take a antibiotic when you get a dental procedure done, or they'll suggest that you do that to prevent infection from getting into your bloodstream via the mouth and going into the heart valves. How about some others? There's lots of them.
Any type of clotting disorders that affect?
Absolutely. Clotting disorders, thromboses, right? Can cause strokes, can also cause heart attacks. Very good. How about angina? Anybody heard of that before? Yeah, angina being one more of a pain in the heart, right? Usually brought on by exertion. Represents the heart not getting enough oxygen for a short period of time and can progress into something more serious later on. I mentioned before arrhythmias or problems maybe in atrial fibrillation or a time when your heart isn't pumping correctly. It may be just fluttering or it's beating out of rhythm, skipping beats. Arrhythmias being related to the nerves of the heart, right? That electrical network that's unique to the heart. I think we covered most of it. Yeah, those are good ones. And again, we'll get into a lot of those when we talk about markers for heart disease and causes of heart disease and what those look like. So a couple myths I wanted to kind of debunk for you straight away. And some of these you probably already know as myths. Some of them might be a surprise to you. First myth spurred out of a kind of a desperate attempt by modern medicine to find a solution to heart disease. And they ended up pointing the finger at fat as being the major contributor to heart disease, mostly related to cholesterol, which I'll mention a little bit more about at the end. So the myth is that fat is bad for your heart or is bad for your cardiovascular system. This is actually not the case at all. What matters is what kind of fat you're consuming, okay? There was a study done in I think it was 1990, where they put 20,000 women on a low-fat diet for 8 years. And they had 20,000 women on a regular diet for 8 years. That was the only difference between them. They were controlled. And they saw zero benefit to being on a low-fat diet. In fact, the women who are on the low-fat diet didn't even lose weight compared to the women who were in the other group. So there was no decrease in risk for cancer, no decrease in risk for heart attacks, nothing with these low-fat diets. So that right there can kind of tell you 8 years of a low-fat diet, 20,000 participants in this study, that must not be the overall answer. In fact, since we started with this obsession with low-fat everything, obesity has doubled in this country. We're eating low-fat items all the time. I mean, everything low-fat, 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 right? Low-fat sour cream, low-fat, everything you can think of. And obesity has still gone up. That must not be the answer. What we look at with fats are we look at the heart-healthy fats, the omega-3, 6, 7s, and 10s, okay? These are the ones that are heart-healthy. And we're going to talk a little bit more about omega-10 and the ways that the omegas can help your heart. But again, it's not how much fat you're taking in, it's what kind of fat you're taking in. Fat's really important. It serves as the backbone for a lot of very important body processes, and if you don't have any, then those are going to fail. So we just have to watch what kind of fats we eat. In fact, fat is much less of a problem than sugar is, which is too bad because in trying to do a good thing, people were driven away from fatty foods and towards high carb, high sugar, starchy foods, right? Instead of eating a steak, people would eat pasta. Shoot, that's actually not what we want to do, right? We don't want to be taking in all those carbs. And Dr. Stacy's going to talk a little bit about how blood sugar regulation has a lot to do with heart health. Another myth is that heart disease is a man's problem. It's actually not true. Since 1984, heart disease has killed more women than men. And that was one that kind of shocked me because I grew up thinking of people on my paternal side, right? My grandfather, not my grandmother, as being a risk for heart disease. And it's actually not true. Heart disease is it's the leading cause of death in women over 65 years old. It looks a lot different in women than it does in men. Maybe some of you have heard heart attacks that when we think of symptoms of a heart attack, we're thinking of male symptoms of a heart attack. Female symptoms are very different. Sometimes heart attacks in females look like nausea. There's no pain, there's no shortness of breath. They think that they ate something bad or that they have heartburn, right? And they're actually having a heart attack because it presents very differently. So certainly not just a man's problem, and I think now probably more so women's problem even than a man's problem. Another myth is that blood pressure naturally rises with age. I think I speak for both of the doctors and myself when I say it bothers me to hear people say things like, well, I'm getting older, so this is just to be expected, right? If they're talking about any sort of health problem they have, they attribute it to age because that's the lie that we've been fed for a long time. That as you get older, you get sicker. That's just how it goes. Not necessarily true. I think the reason that some of these things happen is because we change our risk factors as we get older. We could become more sedentary. We're more likely to be obese. We don't exercise as much. A lot of times we don't sleep as well as we used to. Our hormones change and we don't do anything about it. We start on medications we don't need. Right? There's a lot of risk factors that do increase with age, but not age being the determining factor. It's the risk factors themselves that we can mitigate quite nicely actually, but a lot of people don't because they just blame it on age. The last one that I have is that high cholesterol is linked to heart disease. In fact, they have very little to do with each other. The cholesterol kind of was part of that whole myth that fat is bad for your heart. It was the marker that they used to determine how people were taking in fat in their diet, which is not an accurate marker at all. Dr. Dunbar is going to talk about some much more accurate markers of heart disease. But 50% of people with normal cholesterol have heart attacks. Normal cholesterol. That's half. I mean, how could that possibly be a link? It's the same thing as that study I was talking about earlier. The majority of people dying of heart disease actually have normal LDLs, and Dr. Denbour told me total cholesterol levels are normal in the majority of people who do die of heart disease. So cholesterol is not a good marker for heart health. It can be a concern for other reasons, high cholesterol, but we found that other things drive it up that we wouldn't necessarily think of when we think of heart health. Questions on that? Any of the myths? Were you surprised by any of these? No? You kind of, a couple people shaking their head no. Some people, yeah, it's more of a, I know I was probably mostly surprised by the women's thing, that women are suffering from heart disease just as much as men are. Okay, next up, we get to talk about markers of heart disease, and I will hand it over to you.
Okay, thanks so much. I do have a question for Dr. Kate.
Yeah.
And that is, how does a woman present with heart disease versus a male?
With heart disease?
Or heart attack, I meant to say.
Attack?
Yeah.
It's, from what I have read, it's, the common symptoms are not the same. So it's not that left-sided pain, it's not shortness of breath, it's nausea, it's, that was the main difference that I had thought of, that a lot of women don't recognize
Right,
as
it's a little more subtle, less
heart
classic.
attack. Yeah.
Yeah. And do they on average have heart attacks later in life than men do?
I don't know.
Yeah. For some reason that sticks in my brain a little bit, that I saw that in research at some point, that I think that we got onto this myth that males have higher risk of heart attack, but it's maybe skewed a little bit by the fact that males have them at a little bit earlier age. I think it was an average of 4 years. And thus it's a little bit more newsworthy if you have one at 64 versus 68. I don't know, perhaps. But we're in such a male-dominated society when it comes to research. I think that's it more than anything.
I was going to say that too, that because we studied men, because those were the people that we were getting for research studies, we decided that that was across the board for all humans, and women and men are not. They're
not equal that way at all. No. Okay. It is one of my pet peeves, is that we're so dominant as far as research goes into male. It's pathetic. So markers of heart disease. Well, know your family. That is a big one, and I'm going to go into genetic expression later. But if you have a family history, it does not at all make it inevitable you will have heart disease. But it should give you pause, and it should make you go into a corrective stance to prevent it more than other people would. Does that make sense? So all of my 5 uncles on the Denbour family side, 4 of them have died very early of heart attacks. Therefore, I should be taking extra precaution, shouldn't I? And yes, I take my fish oil faithfully, I exercise, and I avoid inflammatory foods because it runs extremely strong in the Denbour family, right? It's a strong family history. And if a patient like me were to come in with some shortness of breath and you ask what family history, you hear that, you're going to order an EKG a little quicker than you would otherwise. Does that make sense? Family history is really important. Patient symptoms, we just kind of discussed that with this mentoring back and forth. And that sense of unease is very strong. I've seen that in patients. And it's fascinating because in the Bible it says often that the heart is the seat of emotion. And it refers on and on about that. And I think that even though it has its own electrical system, as Dr. Kate so eloquently described earlier, there's still some connection electronically with the brain somehow. And I think that at some point, the gut, the head, the brain, the heart, and the gut is going to be looked at as one system that really communicates very closely with each other. We're just starting to get hints of that research now. I think it's fascinating to see that research, yeah, the patient symptoms are of course number one thing that we look at. Blood pressure. When you're having heart issues, do not necessarily spike. They actually may go down. I've seen with arrhythmia, blood pressure dropping. Oftentimes it goes up though. So abnormal blood pressure, I'm not going to say high or low on this one. just the change in blood pressure. And of course, constant high blood pressure can be very damaging. You get hypertrophy of the ventricle, and it can change what we call the ejection fraction, which is how efficient the pump is. And so blood pressure is a big deal. I really like checking out homocysteine levels. Homocysteine levels has a long record. And it really is a measurement of methylation. Look it up in one of our blogs. Check methylation. And methylation is really a repair system within the body, driven mainly by the B vitamins, that repairs arterial damage. From peripheral arterial disease, to varicose veins, to atherosclerotic kind of damage within the arterial walls within the heart. So methylation fixes that. It can actually reverse it. And homocysteine is one sneaky little way to check to see if you're methylating, if your repair mechanism is working or not. It is very elegant, it's very important, and much more indicative than overall cholesterol levels. There's another one here called C-reactive protein, and this is essentially an inflammatory marker, because we now know, and always have known, by the way, that inflammation is what's worst of all for heart health. Inflammation is what attacks the arteries. LDL, that's one of our cholesterol markers, and that is supposedly the bad one. Folks, it's not bad at all. LDL is a good guy. It is a good guy because it transports cholesterol, fats, wherever we need it. Because 20% of our brain is composed essentially of cholesterol. We need cholesterol up there. LDL is the one that carries it up there, creating mental stability. It prevents Alzheimer's. LDLs are good until the body becomes inflamed. Then all of a sudden, LDL becomes oxidized, and now they are like little bullets that can bury themselves in the artery wall, causing grave damage. And when you get an explosion of that little volcano that comes over there, that is the cardiac event. So LDL, the measurement of LDL, doesn't really tell us anything. Whether the patient's inflamed and has LDL problems, that will tell us something. So the C-reactive protein is that inflammatory marker. Funny little story, here at West Michigan Heart, one of the chief researchers there, I ordered this test, about, I'd say 15, 18 years ago, on one of my patients, because I wanted to know how inflamed they were. And I got a call from him. I don't often get calls from these specialists. He says, why do you want to order this marker? It's just a really old marker from the 1950s. He did some research on it for inflammation. I mean, why would you want that? I says, because that's one of the primary causes of heart disease. He was rather polite, but he was just, okay, that has nothing to do with anything. You know, it's the cholesterol and this and that. I got a call about 3 years later, and I thought this was really big of him. He had gone to my home country. There were some leading seminars being held in Rotterdam, which happens to be my hometown. And they had just learned of this very new marker that was more predictive for heart disease than any other marker, and it was C-reactive protein. And he was so excited about it because he'd heard about it once before. And so it's only about 15 years ago that the medical profession started becoming on board with this one. And just, I would say in the last 5 years, has become more common as far as everyday testing. It's cheap to do, it tells us a lot. It's, when we do order it, make sure it's the high sensitive C-reactive protein, HS C-reactive protein. It tells us a lot more than just C-reactive protein. Hemoglobin A1C, this is a marker that for diabetics. This is how much sugar fluctuations you've had over the last 90 to 120 days. It essentially tells you the damage that has occurred to the red blood cells from sugar fluctuations and the oxidative stress, the glycation stress that occurs thereof. Now, why would you want to know this? Hemoglobin A1C is sugar stress, which equals inflammatory stress. I would venture to say that the majority of our inflammatory insult onto the heart is actually just blood sugar fluctuations insulin being too high, insulin resistance coming about, and the damage that is caused thereby. And you can so easily measure it with hemoglobin A1C. Hemoglobin A1C thus has not yet become a mainstream marker, but mark my word, it will. It will become a mainstream marker, and I'd like you to request that test or order it through our website whenever you're checking your overall health. It is an extremely important one. And read about it in our blog also, where we explain it's under a banner called glycation. Okay? It has a lot to do with brain function, and it has a lot to do with Alzheimer's, and yes, heart disease. So HDL is your very protective cholesterol. LDL is the bad cholesterol only when we are inflamed. So I like looking at HDLs because it really is a marker for exercise. That's the one way we can drive it up very easily. Dr. Stacy is also going to cover one of our fish oils that will drive it up, and the only one that we've proven so far. It's the pharmaceutical companies have tried like mad to find a drug that raises HDL. Pfizer almost came close, but they had to pull the plug on it at the last minute because 8 of their patients died in the last trial. HDL is very difficult to raise with pharmaceuticals. Exercise and this Mega-10 oil that Dr. Stacy is going to cover is what really rises it. Triglycerides, what is that all about? This is just fats in the blood. No, it is another marker of how you are metabolizing your carbohydrates. So hemoglobin A1C and triglycerides go together. And what I like about triglycerides, it's a little bit more immediate. In other words, a patient can come in with high triglycerides, so I know they have sugar dysregulation, I know they're pre-diabetic or diabetic, so I know there's damage occurring to their artery walls. And you know what's fun about that? We can put them in boot camp, which is our lifestyle therapy, which takes away the easy to digest carbs, the ones that makes your sugars go up and down too quick. We go higher in the fats, we go higher in the proteins, and we make the patient less inflamed by taking away inflammatory foods, and watch that number normalize within a month. It is absolutely amazing how you can take a patient that's around 300, which is way up there, to virtually normal levels in just a month. Whereas hemoglobin A1C is a little less satisfying because that takes 90 to 120 days. And patients want to see results now. So we like triglycerides, it's a little bit more of an immediate marker. Causes of heart disease, I struggled with this one. So I came up with some esoteric things, and here we go. Hang on for a sec, okay? This stuff, I'm sure you can go all over the map with this one. But inflammation is on top of the list. It is without a doubt the #1 cause of heart disease. How inflammation comes about is different for different people. The sugar fluctuation I mentioned. Had this patient started with me, I would say close to 25 years ago. This patient, I watched go through seminary school here. I watched him get married, kids, and gradually become more and more obese. I would try to change ways, came in for chronic back issues. He would happily get adjusted. I said, "Doc, that feels great." And then I would preach to him about the diet and how he's inflamed, and blah, 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 and he would smile, and he would humor me by taking just a vitamin D and a multiple, and that's about all. Then I said, well, let's check your cholesterol, let's check your sugar levels. It's about a decade ago. Through the roof. That gave him a bit of a scare. He had the big apple shape. And he started backing off, would probably tell me how he resisted that Coca-Cola that day. And so he was really just dabbling in reducing sugar, but not really doing the corrective stance that he was supposed to. He was just reducing, and reducing is not enough at that point. You gotta do corrective measures. Then I got the call from his wife. He's in the hospital with what appears to be major heart attack. Okay, very young. But really, they can't find a heart attack. He had every single symptoms, from the crushing on his chest to the sweat to the nausea at the end. incredibly high blood pressure. EKG, no damage. Echocardiogram, no damage. They cathed him. It looked okay. So he comes to me about 2 or 3 weeks later after this scare, and said, you know, what's going on? I said, you almost certainly just had a sugar spike, which caused an exaggerated insulin spike, which caused an inflammatory event to hit your heart, and you had the symptoms that you had. It caused a vasospasm within the arteries, but it's not quite the same as a heart attack. It just acts like it, and this is a real warning sign. You cannot afford this. So he behaved a little bit more, and then went back to his old ways, saw him once a month just for adjustments, and then I heard, had a fatal heart attack about 14, 15 months after that one. It was so preventable. It was so preventable just by decreasing inflammation and just letting those arteries clear themselves. You know, if I put a patient like that on boot camp, if I get them to regulate their sugar, if I teach them the way that they should go and they actually follow it, they can clear their arteries, including complete blockages, in 6 months. I've seen it here more than a few times. They can completely clear blockages in 6 months. The way that we are created, it is amazing what you can do to change your heart health. You don't just have to control it. You can actually, it's almost like giving yourself a new heart, a heart transplant. Just give it a chance. So inflammation is a big one. Oxidative stress. This is aging stress. And I pointed it out. I was doing a report of findings today on a 38-year-old. And I was teasing him. I says, you know, I could practically be your dad, but look at you. And I took him to the mirror and I said, look at all these brown spots that you have all around here. He says, yeah, I've had that for the last bunch of years. Oh, I says, that's toxicity. That's oxidative stress. That's like rust on metal. That's your liver not being able to cope with everyday life, with all the junk you're pouring into yourself and all the stress you're exposing to yourself to. And all these spots are now starting to appear. Oxidative stress. Guess what? It's happening in your arteries also. And that woke him up a little bit, and then I explained to him how we have to put him on an antioxidative stress kind of a lifestyle. Altered gene expression is the same one. Just a while ago, I was studying with my youngest daughter. I get to do homework with her, everything except math. Don't go to dad for math. Mom does math. And this was biology, and she was studying genetics. I said, ooh, we can do this. We studied genotype and phenotype, genetic expression, and all those things. So I explained to her, and she got it, the Native Americans, how they have altered gene expression. And this is really, and you've heard me go through some of this. Some of you are nodding your heads. Because look at the Native Americans today. They are short. They are fat. They have pock marks everywhere. Average lifespan for the male is 44. Average lifespan for the female is 48. Go back a little over 100 years. Same people, same genes, outlive us, no problem. Tall, lanky, athletic, very healthy. Same genes, different environment, right? So you can change your gene expression. So when somebody says, well, it's in my genetics, right? Heart attack runs in my family, the whole thing. Yeah, you do have those genes. And those genes can be talked to in a nice way, and you can explain, and it can then become this beautiful fairy tale of a beautiful life. Or you can give it bad information, and it can become a tale of horrors. It is amazing how we can make the piano, just imagine it's a piano, horrible music versus good music. We control the lever as far as the input for genetic expression. Autoimmune reaction. So now we're talking inflammation again of some sort, but it's definitely gut related. All autoimmune disorders are really gut disorders. And when the gut gets off, for whatever reason, whether it's too many antibiotics, And Dr. Stacy saw this patient today who had been on antibiotics 14 times in 1 year and is now how old? 12. And absolutely debilitated by depression, vertigo that she has to use a walker, nobody can figure it out, migraines nonstop every day, and basically failure to thrive. Totally non-functional. Her gut is so off, it's creating so much toxicity within her system that everything is just shutting down, and I'm sure as we speak her heart's being damaged. So this is a really important one, the autoimmune reaction. It's part of the whole inflammation family, but I chose it as a separate topic because it's become so rampant. And then there's this interesting little thing we stuck at the end called endothelial dysfunction. And this is a dysfunction of the artery wall. Basically look at it as an infection. So we can have an infection somewhere from your appendix to gingivitis to this festering little boil you might have, and it can go systemic, and that infection can travel and alter your endothelial wall, the artery wall. And that by itself can also cause heart disease.
Who would pick up on that, Doc?
Who would pick up on that? That is a really tough one. It's those markers like C-reactive protein would pick up on that. There's also something called sedimentation rate that goes up. There's abnormalities in your white count that would show that. There's also really, this is an esoteric one, but a vitamin D ratio of inactive to active vitamin D ratio. If I'm suspicious of it, I do this special vitamin D test, and the ratio of that will tell me if there's a systemic infection like that going on or not. It's a very little known thing. It's only come out in the last year or so, but you can pick up on it. And of course, symptoms. Always go with symptoms. Yeah. Mm-hmm. All right. So, Dr. Stacy's on deck. She's going to talk to you about some really exciting new nutraceuticals, advanced technology. Take it away.
Thanks, sir.
And have fun with it.
Alrighty. So basically we wanted to discuss everything that you can do with the heart. Really take home for this is lifestyle really changes everything. And you're going to see as I get a couple slides in that they've done studies on lifestyle, and it shows 40% change over drugs. So lifestyle makes much more of a difference than just taking a drug. What I started out with just some basic nutraceuticals that we use in the office whenever we have somebody come in with heart disease. Depending on the type of heart disease, will depend on where we go. Magnesium glycinate is a very common one that we'll use. Most people understand that magnesium is in the body. We know that it's present. Most do not know that it's the fourth most abundant nutrient in the body. Very, very common to be deficient. 60% of Americans are traditionally deficient in magnesium, yet don't know it. And really, I wanted to put out some diseases that actually show, besides heart disease, of what magnesium deficiency shows. Atherosclerosis, obviously we've talked about that. Hypertension, which a lot of people don't really put together because they're not showing heart disease. They're like, oh, I just have high blood pressure, that's no big deal. Magnesium does a wonderful job of bringing down high blood pressure. Typically when the blood pressure is off, it's a magnesium deficiency issue. Osteoporosis. There's an interesting one. Osteoporosis makes a big difference for magnesium. Most of us don't realize if you're eating too acidic of a diet, what does your body use in itself to make us more balanced? Calcium, right? So if you don't have enough calcium-magnesium ratio, you can't make bone again. So we're trying to eat all of these things that have good calcium, but if there's no magnesium balance in there, there's no way to build the bone back up. So this all comes back to diet, once again. Diabetes. Magnesium depletion in diabetes, quite a bit, just because magnesium also necessary to support cellular health. Really, in general, you just need that for some of your ATP to keep things moving. Some cancers will also have some magnesium deficiencies. Magnesium becomes deficient a lot with different medications as well. We have to think about some of the medications that we use. I know traditionally you don't think, oh, I'm taking this medication to look it up and say what nutrient deficiencies you could do. Anybody can Google that. You can just put Google, lisinopril, nutrient deficiencies, and you'll come up with whatever shows up on there, and those are traditional found through research. So it does help you to learn on your own what else may I need in my diet, or can I get this more through food? Many of us, depending on what we're doing, you know, drug-wise dosages, you may not be able to drive enough of it through food, and you may have to supplement on top of that. Diseases that can actually create more of a magnesium deficiency that aren't as traditional, any type of digestive disorder, irritable bowel syndromes or ulcerative colitis, those create a lot of magnesium deficiencies. Think about it, whenever we have diarrhea, what's happening? We're changing our electrolyte balance. Most of ulcerative colitis and IBS traditionally go back and forth. And a lot of people will struggle with having more bowel movements a day than less. Diabetes, hyperthyroidism, which a lot don't think about, kidney disease, which we make sense of. Diuretics are probably one of the biggest medications that I found that deplete magnesium out of the system. Most of the time you'll see your doctor telling you to take a potassium pill. Magnesium is also beneficial at that point. And really potassium, little key point there. Avocados over bananas, please. They don't regulate, they don't change the sugar, which then brings you into heart disease because you're adding too much glucose in the morning. The avocado with a good fat keeps things low, nice steady blood sugar throughout the day. It doesn't create that inflammatory reaction. Foods that deplete magnesium. Who's a coffee drinker? Yeah, there's one of them. Pop, soda, depending on where you come from in the country. Pop, I came up here, but out in St. Louis when I was going to school there, it was soda or soda pop. You can use them both. Alcohol, as always. Salt, that's one of the reasons that a lot of your cardiologists will say, I want you on a low salt diet. It's because that will deplete the magnesium. Instead of saying, hey, I want to have you eat more foods that have magnesium in them, they say we want you on a low salt diet. One, because usually most of those patients are also having high blood pressure. So you kind of got to balance those things out as well. For women, heavy menstrual cycles, a lot of prolonged stress. We don't think of things in our life creating long-term stress, but when we have a patients come in with adrenal fatigue, when we do a blood pressure from sitting to standing and we're not getting that 6-point rise, that means you've under adrenal fatigue and you actually are struggling from magnesium deficiency. You fall within the 60%. So, some symptoms of deficiency, because a lot of people don't realize that either. Anxiety, that can be a really big one. Irritability, restless legs, really common. If you know anybody that struggles with restless legs, they just sit there and they bounce and just can't get them to go. Magnesium is a wonderful, wonderful thing. It's like a miracle cure for a lot of people. Sleep disorders, nausea and vomiting. Abnormal heart rhythms, which Dr. Kate had discussed as well. Traditionally, you can, if it's not too far gone, magnesium can help to regulate those. I have lots of patients that'll come in and I'll be listening to their heart. We'll have abnormal heart rates just in one quadrant of the heart that I'm listening to, and I'm thinking, this is not a normal heartbeat. We'll talk about it. We'll ask if they've had an EKG, start on magnesium. Next time they come in, no problems whatsoever. It sounds like a normal heart. So for them, it was just a magnesium deficiency. But that is a leading, it leads up to some other disease that could be there, because most of our diseases are a deficiency of something in the body. So magnesium for us, obviously, it supports the endothelial cells. Proper heart function, we wouldn't be using it if it wasn't for proper heart function. It can lower triglycerides, raise your HDL, and lower cholesterol. This is a very minor raise in HDL, so don't think that you're going to take magnesium and be able to skirt out of that exercise idea. It's not going to work for you. Sorry. Then we also use a lot of times, Dr. Denbour and I are fans of a lot of your B vitamins with folic acid. Vessel Care and intrinsic B12 folate are our most common in the office. It used to be methyl B, but we are losing methyl B this year. So folate has, Vessel Care has the folate, the 5-methyl tetrahydrofolate. It also has some B6 and B12 in there. Really important for that. That does work methylation pathways, which Dr. Denbour had talked about as well, within the liver. So that can also stop some of that oxidation of your homocysteine. So when it says it lowers the homocysteine, which remember he said homocysteine can increase plaquing and increase inflammation. Well, homocysteine is amino acid. What you want to do is you want to help to break that amino acid down, and that's what your B vitamins will do on top of it. So this can reduce the risk of heart disease. A lot of times what we see in the office are genetic predispositions towards the heart disease. And what we want to do is go back to how can we support and stop those predispositions genetic dispositions, boy, I could not get that out. We want to try to stop that. So that's where we go back to the methylation process, because your liver is a very important part of your body. We don't think about it. We kind of take advantage of it many times, but it's very, very important. Foods where you can get folate from. Really always want to hit foods, because I think your foods are a great thing. Dark leafy greens. So minimum of 3 servings a day, folks. We really chintz on this a lot. I mean, I meet a lot of people. If I look at their food journal, I see no greens throughout the day. And most of the time, if I'm seeing greens, it's green beans. Like, that doesn't really count as a green leafy, but we'll shoot for that. Let's try kale, Swiss chard, something like that. But I don't like those. Let's keep trying. It takes about 40 times to turn those taste buds around, And when I was younger, I would not have ever eaten kale. I love kale. It's a staple in my house at this point. Dried beans, another wonderful one. Asparagus. Strawberries have folate. Very good for those antioxidants. We're working on colors here. You want to hit the color wheel as well. So basically, those are the 2 that we start with. Vitamin D, we live in Michigan, folks. Let's all think about that. 6 months out of the year, there's not a lot of sun. So we really need vitamin D. I have a lot of people come in with remember the latest research that said, oh, vitamin D, the D3 doesn't do anything, it's poor supplement. It all comes back to quality. You have to look at the quality of your supplement. Really, you have to look at sourcing, where it comes from. So if it's a very inexpensive vitamin, usually like you're getting it at Costco or something, you want to still check it and find out as an independent assay, does it reach meat label claim? It will by its expiration, most of them don't. A lot of companies don't even check to see if that amount is on the label when they first put it out. So could it be acidic? Could it be rancid at that point? Could be. Vitamin D has so much research. It's been started 5 to 7 years ago and really has gone really rampant from here, knowing that vitamin D, there's a receptor on every single cell in the body. It's not just primary for heart. It helps with the immune system, helps with hormones. So we have to think about that as we go through. Typically, 5,000 IUs is your basic for most patients throughout the winter. I have a lot on 10 to 15,000 IUs a day. Okay, so, and some people, I mean, if you work inside, we work inside. I still take my vitamin D in the summer because I know 8 hours out of the day, I'm sitting in this office. Every now and then I get to go outside, but I'm not getting my full legs and arms exposed for 20 minutes without sunscreen. So I'm not getting all the vitamin D that I would need daily. Okay? And then of course if you use sunscreen, which there is another blog on that one on why sunscreen does block vitamin D, you have to think about that as well. It's not a bad idea to use sunscreen because you obviously don't want skin cancer, you don't want to burn, but there's a point where you need to go make a balance in between everything. And then also look at the quality of your sunscreen. What are the ingredients in them? We don't think about that when we're talking about this. I mean, this is really a minor thing that we discuss tonight in seminar, but really you want to look at everything that you put in your mouth, everything you put in your body, because those can create inflammation and toxicities that can bring on these problems as well. We love CoQ10. As most do not know that CoQ10 is not a vitamin. By any means, not a vitamin. There's high concentrations in the heart, the liver, kidney, and pancreas, which are some of your most active organs. So they need a lot of energy. CoQ10 helps to support energy. It can improve all of these things: endothelial function, hypertension, congestive heart failure, cardiomyopathy, which just means there's an abnormal heart muscle, angina pectoris, heart attack recovery. Now, there was a really neat little trial. It's called the Q-SymBio trial. It was on 420 people in 8 countries, which I thought was really nice because it didn't span just one country and just looking at, because everybody has different foods. And what they did is they did 100 milligrams of CoQ10 3 times a day, and then half of the participants did nothing, so just a placebo. What they found is on average, 14% of the people on CoQ10 experienced a major cardiac problem, compared to 25% on the placebo. So, good decrease. We didn't, and really 300 milligrams, not enough for cardiovascular disease. But they also found that only 9% on the CoQ10 died versus 17% not doing CoQ10. Now, they don't say on this whether or not anybody was on statins or anything else. They just said, we just only tested CoQ10. So for us, you know, my basic is at least 600 milligrams for somebody with cardiovascular disease. We can go up as high as 1,200 to 1,500 depending on the severity of the cardiovascular disease. Statins really, really, really deplete this. There are a few statins on the market that don't do as much depletion, but they really do deplete this. And the longer that you're on the statin, the more you need for the coenzyme Q10. This is where most people will notice too that they start to get fatigued or more tired during the day. That's because you're depleting that energy for the cell. CoQ10 helps to feed those mitochondria and keeps us going. That helps the heart muscle pump. A lot of you know as we go through boot camp, we also use different medical foods. So our boot camp has quite a bit different than a Mediterranean diet because we're working to regulate blood sugar very quickly. But when they did a study with Ultrameal 360, which basically has a good balance of blood sugar, has nutrients, 2 scoops is equivalent to a meal, has hops in there to regulate blood sugar. What they found is that if they did the medical food with a low glycemic load diet and exercise, that they lowered triglycerides by 35%. 35%. The Mediterranean diet only did it by 14%. That is pretty cool. So if you have heart disease or you're showing on your cholesterol panel that your triglycerides are above 100, hey, we need to start changing that because that's showing that you could be pre-diabetic. You could be moving into that inflammatory marker that's creating heart disease. We don't want that. So as you go across, you can see that it also lowered LDL. It did raise HDL by 7%. They did have exercise in here, so remember that's part of the exercise. And then the blood pressure, they got changes like a lower by 4.9% in systolic and 5.7% diastolic, which was great. And look at over on the far your right. Potential side effects? None. Nobody reported any problems as they went through. Now as they go down through here, they also compare that with people who are on cholesterol regulation statins. What statins do is will lower the triglycerides by 15%, 15 to 32% depending on dosage of statins. Also can raise your insulin on that. LDL will drop 30 to 47% depending on what you're on. But look at all the potential side effects. Muscle wasting, neuromuscular pain, liver toxicity, coenzyme Q10 deficiencies. These all lead to other things down the road. And most women, the hard thing is a lot of these studies are done on men. Women, the most common thing that they'll notice is muscle pain. Across the board, that's the first thing I hear is, you know, since I've been taking this, I am really tired, my body aches, and just everything just hurts. And that's because it's also depleting our magnesium very, very effectively. We tend to use more magnesium. That is part of our makeup. If you startle easy too, that can be a magnesium deficiency. So, pretty interesting as you're thinking about what can nutraceuticals do. That is a wonderful one. New this year. Does anybody watch Dr. Oz? All right. Yay, good Dr. Oz fans. The main researcher for his show is from Cleveland Clinic. The gentleman that founded and did most of the research on omega-7, which is part of omega-10 here, is that gentleman who actually does the research for Dr. Oz. And what they had found is omega-7, which is also found in fish, but they have other forms of omega-7 that are on the market from sea buckthorn oil. Basically, what they found is this can decrease the inflammation even more than what your omega-3s can do, which is awesome. Really helps with brain development. We love this one because it regulates blood sugar. It can regulate a diabetic patient very quickly. Wonderful. It decreases inflammation all the way across the board. It'll lower LDLs. It'll lower triglycerides. It does raise HDLs. Now this one, remind you, is from fish oil. Okay? The other forms that they're worried about on the market from the sea buckthorn oil have more inflammatory components to them because when you weigh them side to side, the fish form of omega-7 does not create the inflammation that the sea buckthorn oil does through one of the researches. So that's very important when you're looking at types of omega-7s that you're looking at. The reason why I absolutely love the omega-7, who uses krill oil or knows of people who use krill oil? Krill's the new omega-3. Everybody's been talking about krill. My biggest concern with krill is sustainability. Krill is also what whales feed off of. The problem is it takes so much krill to make our tablets. And really, when you use one of these, it takes 7 pills of krill oil to reach the dose of omega-3s and omega-7 that you can get out of the krill. So thinking about that as well, we're looking at sustainability because with Metagenics, they're always looking at sustainability, using fish that can be harvested that is being put back into the ocean. So we're using clean. Whereas the krill, we haven't really thought about, are we killing off another species? We don't know. Time will tell. So I will turn it over to Dr. Denbour. Got a little long-winded there, I apologize.
Awesome. So, yeah, some pretty exciting things that can be done just with nutraceuticals. Combine that with lifestyle modification, and you see reversal of heart disease, not just control. So, Business Week 2 years ago, cover statistical crunching of all statins, just to figure out how effective really is this multi-billion-dollar industry. So they were basically going after that for an investor. Okay, should we invest in these companies because does this drug really work? So Business Week being all about math, they crunched the numbers, they had charts, it was a very long lead article. And they found that in the end, with statin use, the best they could come up with was decreased risk by 1%. Now, I want you to know, and I'm going to go on a statin rant in just a minute, but statins, 1%, really? With all those side effects? Just eating fish will decrease your risk by 19%, eating fish twice a week. How about nuts, almonds, Brazilian nuts, and walnuts? Those are the best ones out of this bunch. Reduces your risk by almost 1/3. A handful a day, that's it. Folate, that's the B vitamin for methylation. Remember, we hit that one a few times today. 32%. The Mediterranean diet. Always the Mediterranean diet. It seems like we can't beat it, except when we add some components to it. 37%. Compare that to our diet. It increases risk by 55%. We have a monument to our health and lifestyle habits here in the US. It's just, you go to Michigan, down the road, and it's called the Medical Mile. And there you see the gleaming edifices, which are a testament of our lifestyle. We have this fantastic Meyer Heart Center. It is state of the art. It is technology we should be proud of, and I mean that. I have two of my friends are part of the transplant team there. They're brilliant doctors. They really are. But really, 100 years ago, would that building have existed? We estimate just 100 years ago that of all deaths, the cause by heart disease was only 3%. That's only 100 years ago. So look at the whole picture. And allow me to go on this statin rant just for a sec. Statins decreases cholesterol. Cholesterol is the backbone of your nervous system health. So statin use promotes memory loss and mental instability. They're shooting for cholesterol levels of 120, which is impossible to get to naturally. And we know that at 120, we not only get memory loss, we have chronic depression as well. The backbone of hormones is cholesterol. So if we take statins, we're reducing cholesterol. Think about that testosterone study that I mentioned in the beginning. So here we are, reducing cholesterol, thinking we're going to reduce heart attack. We know that's not going to happen. In the meantime, we are reducing testosterone. Have you heard a few times about low T, low testosterone in both males and females? Yeah, it's epidemic out there. I vouch to say that statins is part of the problem. Lifestyle is also our inflammatory lifestyle. So what do? We pour on testosterone supplementation through creams, pills, or injections. increasing heart attack risk by 5-fold. Statin thus has indirectly increased a heart attack risk tremendously. Long-term statin use also, as Dr. Stacy mentioned, decreases our coenzyme Q10 count very dramatically. Coenzyme Q10 is a main engine for our mitochondria. So it's nothing more than a mitochondrial poison. Mitochondria is what we derive our energy from. So one of the main side effects from statin use, congestive heart failure. Neurological disorders. We had a patient here not that long ago who had been diagnosed by Mayo with having the fatal disorder ALS, Lou Gehrig's disease. Was on statins. Says, well, that's not helping the situation any. So I says, humor me, go off of statins. I didn't say it this way, but it really didn't matter anymore, did it? Because we're dealing with a fatal disease. Put him on coenzyme Q10, off of statins, total cure within 3 months. Total cure. The incurable was cured just by resupplying what the body needed. It is amazing how much damage that statins is causing in this country by decreasing economic productivity due to fatigue, depression, and increase in disease. In fact, I saw it I think it was about 20 years ago, that a German study had already showed that by taking patients with cardiovascular disease, one was put on statins back then, and the other one was put on placebo, or on nothing, a zero pill. They found no difference between the two with heart attack. But what was really interesting, the group taking the statins, they followed them for 3 years, had a mortality increase almost 3-fold compared to the people doing nothing. That was the very first study that I saw on the negative effects of statins. And this study has now been corroborated several times, not only over here, but in Japan as well. You're not seeing that hit the headlines, are we? And it's really a shame, because this kind of medicine that we practice here doesn't have the PR machine behind it that the pharmaceutical companies do. So, hitting your inflammation is paramount. Making sure that you're methylating, your sugar levels are on track, that your gut is not contributing to the toxicity within arteries, that you're eating the food to lubricate your arteries and to provide the strength for your heart muscle, that your adrenals are not putting out too much stress, which floods your body with these stress hormones, which causes inflammation and sugar fluctuations. That you're getting enough sleep, because you're not getting enough sleep means no repair, no detoxification, and stress on your body. That exercise gets done, and honestly, it doesn't take that much exercise, it's just movement. I'm talking about heart health here. Just movement. I've seen studies that show that one 15-minute walk a week shows measurable decrease in heart attack risk. Just one walk a week. Let's go for it. Yeah, we can do this. And nutraceuticals, as was mentioned earlier, where we use magnesium glycinate to strengthen the heart muscle, coenzyme Q10 to get the mitochondria, the source of energy, going, a specific fish oil called Omega-10, which we can now prove reverses atherosclerosis within 6 months. In fact, Cleveland Heart Clinic found this so unbelievable that they had to repeat the study. Said, nah, it can't reverse heart disease. It did, with no lifestyle changes in 6 months. So nutraceuticals such as L-arginine. L-arginine gets rid of angina, improves it by 20% within 2 weeks. There's so many things out there that you can do that hold so much promise, and combine that with the lifestyle changes and combining it with all these things that we've talked about. Shocking what you can do.